Thank you. Good morning. My name is Erik van der Goot. I work for the European Commission, and I would like to talk to you about MediSys, a medical information system that we have built and developed over the last couple of years. Actually, MediSys has already been up and running since 2005, with a public system since 2007. Next. I've got too much time here. Okay. The idea is to provide open source data collection and analysis for surveillance and epidemiology. At the moment, the system is used for event-based surveillance by several people. We work closely together with the European Centre for Disease Control and the European Food Security Agency. The functionality is rather broad. We do a lot of analysis on the material that we harvest from the internet: language detection, entity extraction, geolocation, classification, duplicate detection, clustering, quote extraction, sentiment analysis, etc., etc. We didn't develop all this from scratch for this particular purpose. It's based on a product that we already started developing 10 years ago, European Media Monitor, which is a media monitoring product for the Commission. We analyze full content from all the articles that we find on the internet. And we are not a crawler. We also don't store the articles, so this is really about real-time alerting. We are not trying to emulate Google. This is much more a real-time system. But the full content analysis is important. As you can see here, we basically have this open source monitoring engine upon which we have a number of products. One is a news brief. The website, however, is not really the product. It's about the data that you can access through the website. And we've got an editorial moderation interface with which you can create higher level information products. The powerful aspect is the content categorization that we've developed ourselves, where we can also address multiple languages like Arabic, Chinese, and etc., etc. We also have metadata categorization, which allows you to construct categories based on previously assigned metadata. The content categorization is very important. The whole system is multilingual. Of course, we have to deal with many of the languages on the globe. And in order to do the proper category definitions, we get a lot of feedback from the users. Users like the French health authorities, ECDC, EFSA, as I already mentioned, and other medical practitioners that help us in setting up these categories. The multilingual categories have got 50,000 patterns currently in the system. Here you can see the improvement that is the result of user feedback over the years, where we really go to much higher precision and recall of the articles on the internet. We also do alerting based on statistics on the number of articles coming in categories or category combinations. You can see two peaks on the left. One is about Switzerland and the other one about the Russian Federation. This alerting functionality, by the way, is also underpinning some of the work that we do in the EAR project for the Global Security Health Action Group. Here you see the news about Switzerland. When you click on that peak in the website, you will see these articles. One of them is definitely not about the flu. It's the second one. The other one are. There the keywords were simply in place in the right position. The Russian Federation pneumonia one is completely correct. All these articles are about the soldiers that got this stuff in the barracks. Apart from the categorization, we then go categorization and the alerting. We are now going one step further. Here's some information about how to calculate this. We are also going into the domain of semantic analysis. This is much more complicated. All this stuff that you saw so far is basically counts and bag of words kind of stuff. But we also want to move on from that, and we want to do semantic analysis called event extraction, where we basically try to identify really what is being talked about. We've developed several grammars for this. They're language independent because we want to deploy this in many languages. For the medical events, we have English, French, and Turkish at the moment. This is an example of the extraction of event data from the material that we survey. Again, here the results are quite encouraging. We do event detection also for other types of events. We can map it. As you can see, thanks Google, this works quite well. And we've done some research in the results of this event extraction and the reliability. Next slide, there you go. This is the way we evaluate the events. We do many more languages. For the medical events, however, we've so far concentrated on English, French, and Turkish. The system is in constant flux. The team is 25 people. I wish to thank them all because the effort that they put in is enormous. We are going to work, of course, we are already integrating social media in our system. I don't have any direct results of that, but we're working on that. I also wish to thank our collaborators in the form of the French health authorities and ECDC, because without those users, this system would not be where it is right now. And I would like to also thank the organizers for having me here and letting me talk about this system. There you go. Thank you very much.